the aesthetic podcast from Local Women magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi and welcome to Local Women's Aesthetic Podcast. My name's Emma Heaney from Elite Aesthetics, and today I'm joined by Dr Sarah Armstrong from New You Dental and Aesthetics, and we're going to talk all things turkey teeth, composite bonding, Invisalign, aesthetics, and also outside of work, she is a mountaineer, so we've got lots to talk about today. Welcome, Sarah.
Thanks for having me.
So, Sarah, how did you start your journey? Oh, I forgot as well, you also own a gym.
Yeah.
And she's a PT. Do you sleep?
Very rarely.
So, how did you get into dentistry and aesthetics?
I went to dental school in 2013, graduated in 2018 from Plymouth University, which is in the southwest of England. So enjoyed 5 years there in the Cornish coast in Devon, a lovely part of the world. Came back to Northern Ireland and did foundation training in an NHS practice, and actually moved to private practice in the south of Ireland for a few years, and then finally opened my own practice in July 2023 in Jonesborough, County Armagh, which is just outside of Newry. The aesthetics came pretty quick after graduation, so I did my basic toxin training the same year I graduated, and then from there over the last 7 years I've kind of just escalated that into more advanced techniques, fillers, PRP, hair restoration, joint inflammation. It's an area I really love alongside the dentistry, so it's the mix of both, and the clinic's very busy, thankfully.
You have a beautiful treatment menu there, and a lovely collection of treatments. Some of the which I do myself, some of them I don't. So it'd be great to sort of pick your brains on a few of them. The PRP and the joint injections.
Yeah.
Could you elaborate a little bit more on them?
So I love PRP for so many things. I've actually started using it a little bit in dentistry as well. So, PRP is essentially enhanced healing. So if you fall and scrape your arm, your blood clots, that's the platelets, that's the cells we want, the growth factors, and it's the same within dentistry. So, for example, if someone came to you with a delayed healing of a socket, or some people call it a dry socket, I've started actually putting PRP in there. Bit of research and evidence in it now as well with implant placement PRP, but aesthetically it's a great treatment as well. I think over the next 3 to 5 years, I think PRP will kind of take over steroid injections, to be honest.
Yeah.
It's a much more natural process. So we use it mostly for maybe carpal tunnel, joint inflammation within the knees and hips, the TMJ. I love it because it's natural and less side effects, obviously, because you're taking from your own body and putting back in. Mm-hmm. You have to be careful with your anatomy and your landmarks, and you have to educate the patient that it's not an overnight solution. It's monthly treatments to get that result. But if they're motivated, and if these people are going around with this joint pain for so long, they would really try anything at that point. And I've seen some good results with it, and I think PRP is only going to get stronger within the aesthetic industry.
Yeah, we offer PRP, but we also offer PRF. Okay. And we're finding the PRF is sort of overtaking our PRP slightly. Okay. But from a joint pain point of view, I've read some fantastic papers for pain relief. It's an excellent treatment.
Yeah, I've done a couple on the feet, although it's very sore to do it on people. That's the thing. But yeah, they don't thank me at the time of the injection, but maybe afterwards they do.
They're grateful after, definitely. And sort of you've other aesthetic treatments that you offer, obviously the toxin, the fillers, the skin boosters, is that kind of your treatment menu?
Yeah, the treatment range would be that. This year we are advancing a little bit into devices, which is something I've been thinking about I used to go to a trade show every year and think I'm going to buy it, and this year we've finally done it.
Are you allowed to say, or are you going to leave it for a big reveal?
I can give you an idea. So we're going down the laser route. Mostly for tattoo removal, actually, because Brilliant. In the area there's not a lot of clinics offering that, and it's a specific sort of laser as well. MFACE, which is becoming very big. Microneedling, RF microneedling, and a few more.
We have MFACE ourselves in Elite, and it does really well.
Yeah, I'm looking forward to it.
It's lovely results.
Completely new for me though.
Yeah. Great result. Patients love it. It's quite an easy treatment to do, both for the clinician and for the patient to receive as well. So very good. Your portfolio is expanding lovely.
I need more hours in my day. I don't.
And your team, do you have a big team working for you at the moment?
Well, at the minute, it's myself as the principal dentist, and I have 4 other dentists. Aesthetically, it's just myself.
Right.
My sister, who is a general breast surgeon, she comes once a month and does things like IV bloods and private blood tests and cryotherapy and things like that.
Excellent.
So I'm hoping she, over the coming years, will branch out into her aesthetic private scope a little bit more and help me out.
Yeah, it's hard to do everything, isn't it?
Is, yeah.
Especially with everything else that you actually do. Questions, I suppose, like teeth. We're going to go down teeth whitening. I mean, the beautiful smile everybody wants, but it's getting the right whitening system. It's getting done correctly. Could you give advice to the listeners on teeth whitening?
Very simply, it won't work unless it's professionally done. You know, that's just it. Everyone I always ask, have you done any whitening? And they have all this array of stuff that they've done, strips and paste and everything else. But at the end of the day, it doesn't work unless it's a certain percentage of hydrogen peroxide. Only that can be prescribed by a dentist.
Yes.
So therefore, it's all of them things that you read, all them advertising, just come into the clinic and get them professionally whitened.
You said a key thing there. It must be prescribed by a dentist. You know, I think the listeners really need to know that.
Yeah.
Invisalign. Can you educate me a little bit on Invisalign?
Invisalign, I could be here all day. I've been doing Invisalign for around 4 years. I started with quite simple cases. Other dentists within our practice are now offering Invisalign. It is probably our most popular sought after treatment. It comes in conjunction probably with, you would hear it on TikTok and socials, the mini smile makeover.
Yes.
So this is where we would align the teeth with a system such as Invisalign, which is typically quite quick. And then we would whiten, and then afterwards we would finish the teeth off with some composite bonding, maybe to improve the shape or maybe disguise certain things. But what's important is a lot of patients come in and just say, I want composite bonding, and they don't really know what that is. And then they show you their teeth and they're not in line to start with. So composite bonding will only work if the bite's suitable. You know, there has to be some space to add that material, otherwise it will just chip straight off. So a lot of times you have to bring them right back and you have to say, this is what we need to do. We need to straighten your teeth first. And actually, once we straighten them and whiten them, you'd be amazed at how good your teeth then look. And it's simple then to add and contour little areas of composite bonding, little edges, rather than covering your whole tooth with a composite veneer per se, where, you know, it is... People think it's reversible, but it's actually not.
Right,
so it's,
okay.
it's patient education, and I always say less is more. And there's nothing like your own teeth. People mightn't believe that when they first come in, but there really is nothing like your own teeth. So you want to work with them and get the result that they want. And I think we do that.
I think for me, I have very little experience from a dental point of view, and it's a bit of a minefield when you start to read about Invisalign, composite bonding, teeth whitening. For myself, I'm like, where do you start? So you start
with an appointment.
Make a consultation with New You Dentist and Aesthetics, and then you do your consultation and you set them on their journey. Roughly, what's the time span for somebody?
It varies. I mean, I've seen makeovers happen in 3 months. I've seen others 12 months. When I started offering Invisalign treatment, it couldn't do it all. That's really important. It had its limitations, and now I think it's gone over the years. It's got better and better and better. I actually think in the future it will probably replace, in some cases, fixed braces or train tracks.
All right, okay.
I mean, I had a patient I recently finished, and when I first opened the clinic, he came in and he asked me, could he have his teeth straightened? And I said, yep, with train tracks. And he said, no, I don't. I want Invisalign. And I said, it won't work. It'd be a waste of your money. Won't work. 12 months later, he came back for his checkup. He asked me again. I must have been in a better mood that day. I don't know. But I said, okay, look, we'll try. And we've just finished him now. He had Invisalign for nearly 12 months. We whitened, we put some veneers on at the end, and his results, I show it to everybody in clinic now today. And I said, this is what you can achieve with Invisalign if you are compliant, because at the end of the day, it's a removable appliance. So you can take it out. You have to be compliant. You have to bear with it. And it's digitally driven, so you can actually show that patient before they even start the journey what their outcome will be, and that is motivating alone. And I love that aspect of it as well. So to me, it's the future on the right patient.
Excellent. you might have a customer. I suppose we've got to touch on turkey teeth. I mean, it's everywhere. It's all over social media. It's TikToks. There's so many jokes about it, but it's a very serious matter.
Oh, it is serious. And unfortunately, it's something we see more and more often. Listen, you get it in clinic every day. I've gone past the judgment of it.
Yeah.
You know, I think, and I've had patients come in and they are embarrassed because they've seen the TikToks and the joke that people make and who would do that and stuff like that. At the end of the day, they've done it, okay? Whether they understood the consequences of it or not, whether they knew it was as destructive as it was, it's happened. And I find some of them are afraid to nearly come to a dentist back here, which is...
That is the big thing. I'm noticing people are talking about, I can't go to the dentist.
Because, you know, for someone who has possibly had that much work done, that needs maintained. If you want it to last, it's going to need maintained. So I've gone past that, you know, long ago. And like, I've seen some good work too.
Yeah.
It's not all been bad. I've seen some good work. I think the issue is the speed at possibly the work is being done. You know, I've done big cases where we've put porcelain all around the mouth because that's what was suitable for that patient and they were consented to that and the time frame and the longevity of that treatment plan. Abroad, I think maybe it's a little bit more rushed. Implants are going in and being restored possibly the next day. And very briefly, like an implant takes 3 months to osseointegrate into the bone. It's like a screw going into a plank of wood.
Right.
You've got to give it a bit of time. You know, if you put a set of teeth on that the next day on an open wound and send that person off without the proper maybe post-op instructions and aftercare and follow-up, yes, things are going to fail, but things would fail here in Northern Ireland if you did that too.
Exactly.
So, yeah, it's a thing. But, you know, I think patient education is the most important. And I do think we're getting there. And with more reversible, I say reversible, as I touched on earlier, composite bonding isn't reversible. But maybe the word is with less destructive techniques.
Yeah.
People, you know, that's the way people are going down with more preventative and less destructive dentistry.
That's really good to hear. And it's good to hear that you're open to it as well. Because I know I've heard, I've got toothache, but I can't go to my dentist, you know, because I'm thinking you need to go to a dentist.
Yeah. No, I think that's so terrible that people feel like that as well.
They do. They are. I can hear, you know, that is a general consensus that they're scared to go.
When I get people in, I think, listen, just come back every 3 months, get it maintained. It's working now. There's nothing wrong with it. But we need to keep a really close eye on it because if something does go wrong, it's going to go very wrong. So let's not come for 10 years and then have to deal with that then.
Yeah.
You know?
Early intervention.
Exactly.
I find it really interesting to hear about the teeth journey. But I think another, which I found really exciting when you sent me a quick text message, your text messages are a bit like mine, about what you do outside of work as well. You have a gym, you're a PT.
Yeah.
Tell us about that.
So my mother was a PE teacher.
Right.
And so that's kind of what I wanted to do, but came from a quite academic school, was always put towards the more medicine and dentistry topics. And so when I got into dental school, I went, but I really struggled over the 5 years with whether this is something I wanted to do. And I guess sports was something I was always heavily involved in, and I needed a job when I was in university. So I did my personal training and my gym instructor course, and got a job in gyms locally in England. And it was a great moneymaker. You know, I was getting my exercise while in uni and getting free gym membership. So, you know, it was brilliant. And when I came home in the summer months, I'd run classes in the local football club, and that's really how it started. And from there it grew. I converted a garage at the time years ago into a gym. And then I opened my commercial space around 4 years ago in Crossmaglen. And it's going to be open 10 years now next week, which is mad to think.
Congratulations.
Thank you. It's, you know, I used to work part-time as a dentist and I split my time like that. Somehow I now work 6 days as a dentist and still have the gym, but it's more of a hobby really at this stage. An early morning hobby, but a hobby nonetheless. And we have a great community of people there that have been there for 10 years. So I would never let it go because it's, you know, it was my firstborn business.
Yes.
And I love everything about it.
And what's it called?
It's called Strong Fitness,
Right.
Crossmaglen. Yeah.
Your other pastime is you're a mountaineer?
Yep, just to add to the list.
Because you've got loads of spare time.
I got into mountaineering because I couldn't get a holiday. So, no, I've always played sports all my life. And a patient actually came in one Friday evening and said they'd just come back from Everest Base Camp. And I thought, that's so amazing and so different. And she said it was just such a journey, and she'd recommend it for anyone to do. And I was literally opening my dental practice in 2 months' time, and I thought, I'll never get a holiday again. I'm going to go. And that was it. I went with little to no training and went away for a month, and it just opened so many doors. And then I caught the bug, and now mountaineering is probably a sport for me rather than a hobby.
Right.
But I don't think there's many, you know, sports in the world that you can go off into these, you know, the culture you see, and you do nothing but walk and talk, 2 things I'm good at, and be completely present, and nobody can get hold of me anyway. So if something's wrong, they just have to sort it out themselves until I get home. So I love it.
And you're doing Everest when?
I am doing Everest in April 2026. I'm trying to complete the 7 summits of the world. So 500 people in the world have completed it. It's the highest peak in every continent. So there's 7 of them, 2 of which I've done, 3 of which are booked. So all being well, by 2027, I hopefully will have completed them, and then I'll have to find something else.
Well, I'll be keeping an eye on your social media now. I'll be stalking you. Well, if people want to get in touch with you, Sarah, how do they get in contact?
So you can follow us on Instagram at New Dental, Facebook as well, or on our website, www.newdental.co.uk. You can book online. We also offer early morning appointments, late nights, and we open on Saturdays as well to make it more accessible for everyone to seek dental care.
That's excellent. Thank you very much, Sarah. I really enjoyed talking to you.
Thanks.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.